Hi everyone, good evening, and I'm so sorry for this little delay. I'm here to talk about the advances in technology in orthodontics, and we're having glitches with our technology in the presentation, no pun intended. But I'm here and we're live, and I'm really happy and thankful for you and your time on a rainy Tuesday evening here in Boston. Um, Today I'm going to talk about how I have changed my practice and how I utilize high intensity, high frequency vibration in conjunction with my orthodontic cases. So let me get started just by a quick disclaimer. I am not employed by any company. I'm not owning stock or any securities or interests in any dental company, such as Propel Orthodontics specifically, nor any of my family members. I'm just realizing that since I had to move my presentation from my computer to this Mac, my font has changed. I apologize in advance if I have any glitches in the presentation itself. I have been compensated for doing lectures and webinars and live courses, and this is not an exception. But today I'm here to talk about my personal views and experiences with the vibration. Just to give you a little info about me, I'm originally from Argentina. That photo on the bottom screen that you see is Buenos Aires at night. It's a great city, very fun. Right now, the dollar rate is really favorable, so if you're planning a visit, you can do a lot of damage with your shopping. Get a lot. But basically, I was born and raised there, and I went to dental school and did my orthodontic residency. We have here Universidad Buenos Aires and Universidad Maimonides, which is my two alma maters from Buenos Aires. However, in 2003, I migrated north, where I attended both as a student and very shortly after as a faculty, Boston University. And I have been teaching there since. I'm in charge of the pre-doc ortho department and a couple of courses and seminars for the dental residents. And I think it's a great balance. I love teaching, I love sharing time and learning from students and residents at the same time. I'm very passionate. I do things with very much conviction. I don't pick favorites. I'm passionate about teeth and making beautiful smiles. I'm passionate about photography. I'm passionate about food. Rarely you get to see all three in one same shot. I think that was the coolest before and after that I've ever seen. But back to serious, I really believe that we can make a difference with our treatments. We can make a difference with what we know and what we do best. And we can make our patients happy by giving them better quality treatments, faster and more predictable results, and giving them kind of what I call a couture dentistry and providing each patient with a unique experience and try to differentiate ourselves from everybody else around us, especially now that all this direct to consumer approaches to orthodontics are taking so much time and popularity. I feel that what we can do is kind of seriously a couture experience and very unique and catered to our patients, every single and each one of them. What you see here is Coco Chanel actually in her studio, in her late days, actually taking time to make adjustments on a model before a runway show. And this is fantastic. This is what we do. We have the knowledge, we have the technology, we have the materials, we have the hands, and there's nothing less that our patients deserve rather than that, our full and undivided attention. And that is why I joined several years ago, over 10 years ago, an incredible team of professionals. This is our group today. We are a bunch of dentists, professional specialists, multi-specialty practice from endo, perio, ortho, pros, restorative, to a bunch of hygienists, an incredible group of professionals. And what makes us unique is we're not just a group of dentists all working together under the same roof. We have a shared vision, a shared philosophy. We learn from each other. We go to each other's courses and presentations because we believe strongly that we can make everybody else shine brighter by doing what we do best and by knowing what to expect from the rest of the team. This image may seem it look very, very simple and complicated at the same time. The simplicity of the figures and the anatomy takes such an amount of strength and effort and calibration that it's only very few that can truly master it. And we're trying very, very hard to do that ourselves with our treatments. And what I offer, and since several years ago, we started taking advantage of multidisciplinary approaches and what technology has to offer to really be able to provide for patients the next level of smile design and outcome and predictability from the drawing board, from the very beginning. So we know not only what can expect from each other, but also our patients can know from the very beginning what to expect from our approach. And the same way that we use digital scanners and digital treatment planning, digital smile design, I incorporated years and years ago different modalities of acceleration and increased predictability for our treatments. And today we're going to talk specifically about the vibration. I don't know if any of you is familiar with the concept of DSD or digital smile design, but this is a way to actually rehearse or plan a design of a smile onto restorative treatment so the patient can get their emotional input. They can see a mock-up in their mouths. We can see how to design it, and the patient can really understand what this process is going to be all about. And one of the things that it does, and this was in January 2015, and you can see this beautiful patient who had pec laterals and an edge-to-edge bite, that the whole idea was to do treatment on her, and we created a mock-up. And in the mock-up, I don't know if you can see the video. I apologize for that. I think this video is not going to be running, but you can see it was an instant wax up and mock-up in the mouth where she could see and feel what her dentition would look like if we went through the whole process. Obviously, tooth position is a huge limitation for orthodont for this type of treatments. So we needed to do some type of orthodontic movement and created an Invisalign plan. And again, I apologize. This is not going to be playing. I don't think it's going to be running the video, but you can imagine how there's absolute need for reopening spaces for those laterals, reclining of the lower anteriors just to create a little bit more positive overjet and clearance for that restorative to happen. When we first started, and I was utilizing accelerated approaches to treatment, but we decided to start complementing the DSD with aligner therapy. So this is what I call in my practice DSD-Salign. We're taking advantage of both. In this case, I posted the acceleration as an optional, but she didn't want to do anything else. She was happy to slow down. That would give her time to save for her treatment. But within 21 aligners, about a year later, the patient was already ready to go through the phase 2 and restoration. It took her 21 aligners plus 5 refinements just to achieve a little bit better interproximal contact on the lower, but a full 14 months to get from that initial to that final. And here's a shout out to Dr. Priyantaneja, who is the doctor involved in the restorative treatment. Lesson learned. Aligners and DSD can be a royal couple and get a lot of things achieved. However, it takes time. And we need to let the whole orthodontic treatment go through. And for our fast pace and high demands of our patients, that wasn't going to be a routine or a big seller or a big way to approach these cases. Many of the cases get deterred because of the length of treatment. So we decided to give them some tools to this royal couple to be able to really maximize and get through the orthodontics as efficiently as possible and as quickly as possible to be able to get to the next phase, which is the cherry on top. This kind of approach molded in a great way my orthodontic practice. Here's another example, another patient that has a similar situation, anterior crowding and some intensive wear, and he needed orthodontic treatment to be able to go through the restorative phase. You can see here the little edge to edge on that central incisor, the interferences, the space distribution. And the reality is, in this case, we did this with Mops, but we could go from the top left, initial alignment at the bottom, mock-up, and final restoration in only 3 months of ortho, 17 aligners, 4 months total treatment. So this is a huge, huge difference, going from 14 months to a full treatment in only 4 months, beginning to end of the restorative. So this, again, is something that got everybody around me in my practice excited about, oh yeah, orthodontics now, it's not just sending patients to the unknown dimension and hopefully cross our fingers that they're going to come back. They come back quicker, they come back ready and with high predictability. So I mentioned that I utilize both. I utilize Mops and I utilize vibration. When do I choose which? Which one do I choose to do what I need to do? And usually I have benefits for both. Mops is going to be very targeted. They are going to be affecting. We can select the area that we want to affect, which allows me to select anchorage. If I want to limit the movement and the speed just on the lower anterior area and keep the posterior segments as an anchorage, I can only mop that anterior segment. It's going to be a higher biological impact, therefore it's going to be a little bit faster. And it doesn't require any additional patient compliance and less patient burnout. However, high frequency vibration is going to have a set of benefits as well. It's going to produce a mechanical massaging or help to seat the aligners. It's going to stimulate the full mouth all at once. It's going to have some biological impact, not as much as the Mops, but because the treatment is still going to be accelerated, the patient burnout gets decreased. And we're going to have the bonus of reducing the pain or the discomfort, kind of an analgesic in front of orthodontic forces. We're going to be able to produce some catabolic activity during the active treatment, but also we can help with bone formation and aid in retention after orthodontic is done. And even talk about help in minor relapse and utilize our Vivere, our clear retainers, to be able to recapture those teeth that have been shifting out of space. So in summary, my case selection is going to be specific. Are we talking about an adult patient or a growing patient? Do we want to go as fast as possible? Do we want to maximize certain complex movements on a growing patient? We're going to let them grow, so speed is not as much as my top quality as it is predictability on complex movements. Are we talking about a simple treatment or really complex treatment? Am I trying to get something very complex to do, uprighting a root for an implant placement with aligners, and in which case I would use Mops because I want to get the least amount of resistance for that root uprighting to happen? Or are we talking about simple movements, crowding, spacing, and aid on that movement altogether? Am I working with a fixed appliance or with removable? Is the patient local or is the patient long distance? I have an abundance of patients that are in Boston. They here studying or working, they move and they come back. I have, for example, ton of patients who spend their summers back home, a lot of them from Europe or Middle East or out of state. So I need to be able to give them something to go through that will require less supervision, and I trust the vibration is going to help with the seating and make the movement and the aligner fit a lot better. So again, each case is going to be different. I also hear the patient. Are they really afraid of any minor invasive or minimally invasive procedures, or they want to do something as fast as possible? We have a conversation and we make that decision together. Before we get to that, I wanted to touch a little bit on the science behind high frequency vibration. What supports our decisions? It's not just me saying that, and yeah, I have my experience with my patients and it seems to be working great. Can't complain about it, but there's actually evidence that what we're claiming is really happening. The first article that I'm going to show is actually one of the newer ones, but it's by Judex, and it's an in vitro study where he started stimulating different cells present during orthodontic movement, PDL, fibroblasts, osteoblasts, and osteoclasts. And he actually exposed them both in Petri dishes with little boxes. Very interesting. If you go through the article, it's quite interesting how they did this. They exposed those cells to high frequency vibration, low frequency vibrations based on their each manufacturer's recommendations on time of activation, whether it's 5 minutes or 20 minutes. And one of the things that he found that the high frequency vibration produces a higher cell proliferation and gene expression on all those cells compared to the low frequency, but they both showed capability to increase the osteoclastic activity. Both were comparable. Obviously, this is an in vitro study, so we can take that and try to extrapolate to in vivo, but in general, both show to have higher cell activity. There are some human studies also. This has been not published yet, submitted for review for publication, and this is a human study where 58 patients were divided into different groups. Aligner treatment, control changing every 14 days, high frequency vibration for 7 days, and a sham for 7 days, so no vibration. HFA, high frequent acceleration for 5-day changes, and a sham for 5-day changes. And he found that the high frequency vibration stimulation reduced the time needed for efficacy of movement. So basically, yes, it supported that patients, when they had vibration, they could shift through aligners in 5 and 7 days with much higher predictability. And he found an increase in cytokines and bone remodeling markers in the crevicular fluid. This is a very interesting study by Nicosisis and Shipley that also they took 75 adults multi-center in their practice, and they had a control, and again, high frequency vibration for 7-day changes. And they found that they reduced the discomfort associated with orthodontic activation. It produced kind of an immediate relief after adjustment, after seating of brand new aligners. And patients' compliance rate was much, much higher, especially after 5 minutes of vibration. Dr. Shipley also just published another article not too long ago where he studied 16 adults with crowding of more than 5 millimeters, class 1, and he compared the predictability of the movement on control 14-day protocol versus high frequency activation for 5 days. And he noticed that patients with vibration showed better tracking, faster treatment, and requiring fewer aligners to complete the treatment and fewer refinements. So that's huge. It's not only that we're flying through aligners, but the movement is happening predictably. One more study that I wanted to share with you is additional studies to analyze, like, okay, we're accelerating treatment, we're moving teeth faster. Is this producing an increase in root resorption? And it wasn't found that there was any additional root resorption on those. And this is basically what supports the theory that it can help in retention. Dr. Alicani published again earlier this year an article that where he found that in presence of orthodontic forces, you can see a catabolic activity, so bone is going to be resorbed, but in absence of orthodontic forces, there can be an increase in the bone density on those areas, more anabolic activity, which can aid in retention And I think that's my personal idea. I think that the ramifications from this could be huge, because maybe we can start utilizing that with our colleagues in perio and see whether that can improve the periodontal prognosis of certain cases. So back to my clinic and how I implement this vibration. Basically, when I start with a patient and I get them for a consult, I start talking with them, I get their scan, and I get an instant simulation and show them what potentially can happen. The first thing that I ask them after I know exactly what motivates them to get started is, okay, so do you have a deadline? What's going on? Are you getting married? Are you moving? Are you changing jobs and you're gonna be out of town? Are you graduating when you need to be finished? Do you want to do this and take your time and time is not a concern, or the whole idea of a lengthy treatment is one of the blockages towards orthodontic treatment? Then it's important to listen to them, because the first excuse for anything is going to be the easy way out is it's all about the money. But then you start listening, talking, yes, and I don't want in 2.5 years in orthodontics, or I'm moving, or I'm going away and for X amount of months. So this is a great opportunity to start talking about how we do things different and how this adult orthodontic treatment is going to be so different than the one that their little kid in middle school is getting through, or how they remember their orthodontic treatment was when they first started. We have a lot of new and exciting things to share and help with their movement. And just to make it graphic and talk about the predictability and the speed and the resistance to movement, I tell them, okay, imagine you're standing and walking through a block of concrete. Now imagine how hard it's going to be to walk through it. But if I had something that will allow you to change that concrete to sand and move through that block of sand, is going to be a lot easier, less effort, more faster, with less resistance. And that is something that anybody could relate to. Anybody can imagine how, yes, of course, that offers less resistance and makes it faster. I also show them that's me, that I am in Invisalign right now, and I am utilizing the vibration as well. So not only I do recommend it, and I have to tell you, I have a newfound appreciation for my own patients, because one thing is just to describe what we know symptoms and comfort and ups and downs of the whole orthodontic treatment is, but when you're wearing it and you're doing it yourself, yeah, it becomes real. And I can tell them, yes, you haven't noticed, but I'm wearing this, and I show them my aligners. Most of them get really shocked, because they didn't even notice that I'm wearing it. And actually that photo was at the very beginning of my treatment. Right now I have attachments, bicuspids back, and even on a lower incisor. So they are able to see that they don't show as much. It's kind of discreet, and they're there seated next to me face to face, and they didn't even realize that I'm wearing them. But also that I'm able to talk absolutely normally. So they realize that, okay, that you don't have a lisp, you talk and it can be understood. I tell them that I give courses and I lecture for 2 hours at BU, and I'm giving webinars and all with my aligners on. So that is, if not the biggest selling point, together with the instant simulation, I think it's pretty high up there. And yeah, we don't have to be afraid of charging our patients. This is a bonus. This is a great way to improve their quality of treatment. So yeah, we can charge that, and we shouldn't be embarrassed about it. We can have our own fee schedule, and it's very personal. You want to add another payment at the end of instead of 24 payments, at 25th payment. Do you want to add a premium, a flat fee? I personally charge a flat fee for either of the two. If I use both, I'm going to give them both plus a small additional fee. But I think that it's important that they understand that this is an extra step in our treatment plan. We do believe that it's going to make it better, but also they need to be responsible and value what we're doing for them. Now, don't get me wrong. I have been in certain situations, certain cases, that because I want to get a certain movement unlocked, I may have done perforations or vibration and not charged that. But in general, on a standard, I go even on the breakdown at the beginning with orthodontic plus acceleration. And I tell them, you want to do acceleration, it's there for you. You decide not to do the acceleration, I'm going to be, I'm not going to charge for it. And you can do this, there's no window of opportunity for it. There are certain cases though, and I'm going to show you when we talk about the clinical cases, that I'm a little less negotiable, and I'm going to be offering this as part of the treatment, because I know that especially if they want to do this with aligners, there is no way that I can do this in a timely manner and with the efficacy that I want without one of the two methodologies of acceleration. So, enough words. Let's start talking about clinical cases. And I'm going to show you a few different examples from simple to more complex or even more fun. So crowding, I think that that's a pretty straightforward approach to vibration, from mild, moderate to severe crowding. I think that the vibration is great. Actually, both vibration or Mops are great alternatives. This is Barbara. She was one of my colleagues in the Brookline office, and just a few months before retiring, she decided, oh, well, now I want to do my Invisalign. I want to get started. So we did. And it's not a crazy case. She's class 1. She has a little bit of crowding, a little retrocline incisors, which sometimes I find a little challenging. She has a 180-degree rotated upper left second bicuspid, which I was not going to change, but it was just going to be an anterior case. And we started with aligners, and because she was retiring and possibly moving, she didn't want to be coming back and on and off to the office. We decided to do this with vibration. And at the very beginning, because I wanted to see truly how well those aligners were seating and working, we started with 7 days per aligner. 17 aligners later, 17 weeks later, beautiful alignment, upper, lower, she's already in retention, and this has worked beautifully, very predictable with no additional issues. How about those retainer relapse? And I'm not going to go too crazy on showing you a lot of crowding cases. This is our bread and butter. We all see that every day. Now, this case I borrowed from Dr. Shepley. He showed a case where he had finished treatment and he had a very poor retention, actually, very poor compliance. And you can see those lower incisors starting to show a little bit more relapse a year later. And what he did is, okay, bring me your vivarium retainers. We'll create some dimples and I'll have you wear them. Of course, it's really hard for those to get in. They're not seating quite well. And utilizing the Vipra on the same day, you can see how already those teeth are sitting a lot better within the retainer. 4 months with the vibration use, same retainer, you can see how much better this is fitting. So I think that was fantastic. It's a great utilization, and I think that is important that patients know. You can either keep their vibration devices throughout treatment. Don't throw it away. Don't give it away. Don't try to sell it on eBay because it's yours and it's going to give you still really good benefits even after we're done with your orthodontics. I don't even know if it's allowed to sell those on eBay. Anyhow, never said that. Let's talk about spacing. This is a very simple relapse case, mild spacing, procline incisors, easy to deal with aligners. You can imagine that this is something super straightforward. With 17 aligners in 17 weeks, 1 week per aligner, the patient was already absolutely happy, space closed, aligners fitting perfectly, and already on retainers. Now, let's get into a little bit more complicated spacing cases. You can see in this patient quite severe spacing on the upper arch all around the canines. One of the canines rotated almost 45 degrees. Actually, no, more than 45 degrees, almost 90 degrees, about 60, 70 degrees. And in interference, it's like those primate spaces almost, interference with the lower arch, and flared anteriors, kind of an U-shaped or V-shaped maxillary arch, and teeth that are for the most part, small. I was very skeptical, and when I started treatment with her, I thought that I would end up needing some buttons and elastics to help rotating at that upper left canine because of the amount of rotation it had and how conical that tooth is. We started with records in November. We didn't start with aligners until a month later. And this is October, 38 aligners, 38 weeks on a patient that is a really good patient, using chewies, using vibration, and really making sure that those aligners seated all the way on that canine. I never ever got to use an elastic in her mouth. And you can see how that upper left canine rotated beautifully. You can see the comparison, what the ClinCheck said that she would look like to what she actually really did. And you can see that there's obviously a much more open bite in the ClinCheck. I exaggerate my bite opening as a vertical control on those anteriors as I'm retracting them, so to avoid dumping them and deepening the bite. But you can see how those spaces have been almost completely closed, and this is less than a year later. And in February, after 7 aligners more of refinement, we just finished tightening the contacts, and the patient was absolutely thrilled. I was actually absolutely thrilled going through 45 aligners in only 14 months and actually needing refinement, not for the rotation of the canine and the space closure, but just to tighten and completely align the upper incisors. I'm really picky and I wanted to have them absolutely perfect. Lower incisor extractions are one of my favorite cases for vibration, and actually was one of my first cases where I started trying vibration because it allowed me to go through the process, reduce resistance, and have the patient really help seat the aligners. We know that controlling the root movement is critical, and having something helping us really go through that movement in a parallel fashion is going to have to be fitting like a glove on those teeth and on those attachments. I don't know what your personal preferences are for lower incisor extractions, but aligner seating on those vertical beveled attachments, I use 4 or 5 millimeter vertical bevel attachments on either side on all incisors around the extraction side, just to help create that bodily movement and compensate with gable bending. Fitting and sitting, it's a must, and it has to be absolutely perfect. And I found that the vibration devices are really, really good at that, at massaging those aligners into place. So let me show you Khalid. He had a class 3 relation. He had an asymmetric face. He had an anterior crossbite, lateral crossbite, and he was absolutely opposed to the idea of surgery and of braces. Not only that, this is in January when I first met him before getting started. He disappeared for a while, came back, and in May he was going back to Saudi Arabia or Kuwait, I don't remember, for the full summer. So not only are we going to plan for a treatment, trying to coordinate both arches, extract a lower incisor to compress and make that lower arch a little bit more symmetrical, but I was going to lose him for quite a bit of time. So my condition for this to be predictable and let him go for that long without supervision was, okay, we're gonna go through this. It's gonna go faster, but in a more controlled fashion. And that's what we did. He came back week 28 after 31 aligners. And I had crossbite elastics, I had class 3 correction. This is a few weeks after he came back from his summer away. You can see how parallel those incisors look. The upper arch looked fantastic. I just took a refinement or additional aligner scan because the alignment of the lower incisors wasn't absolutely perfect. I just left a couple of those attachments there. You can see on the rest of the incisors, but the lower right too still was very tipped and was not engaging on the aligner. So I removed that attachment so I could still have him wear the same aligner until he came back without any negative effect. And I could design a new attachment for that just to continue with treatment. But this is 31 aligners. You can see and compare with them with the top side of the screen how those teeth have shifted and how predictably that movement has happened. The bite was closed already and the space was almost completely closed. This is in April, was 14 months after getting started. 31 aligners plus 23 refinements, and you can see a much more centered and symmetrical face. Cross bites are gone, both anterior and posterior. Can compare initial and final. I was still doing 1 week aligner with the high frequency vibration, and mainly because when patients go away, I don't want to give them that many aligners, because I want to make sure that yes, they go through them, but they are wearing them and they are really making sure that the movement is tracking. What I started noticing on my patients is some cases when I move them into 5D aligners or 4D aligners or 6D aligners, some aligners don't complete the job all the way. So usually I call it as job completed instead of just calendar switching. So I have them really involved on how their aligners fit and how the teeth are tracking. When the patients go away for 3-4 months at a time, it's very hard. It's a lot to ask for them to check for that many aligners. So I stick to 7-day aligner all the way. This brings me back to my last category, and probably my favorite category for this type of acceleration modality. Yeah, so far with spacing, with lower incisor extraction, with crowding, relapse, pre-pros, I could recommend either of the two. I do like utilizing Mops for both, but the one type case that I am non-negotiable, that I absolutely want to have a vibration from beginning to end, is with open bites. I'm sure that you may have tried treating open bites with Invisalign, and those are really, really fun to treat and really satisfying to treat because you see a lot of change very quickly. And the great thing about the vibration devices is that they stimulate the full mouth. And the way that I like closing posterior open bites is by intrusion of posterior teeth, selective intrusions. And I really need that activation to get through the back, but I also want to make sure that the aligner is really seated and anchoring on anteriors without any disengagement. I don't want those anterior segments to hang low from the teeth, because that is what gives me more predictability and more vertical control. And I feel that the vibration devices are going to be really, really good at helping with that. So let me show you a few. Actually, I have 2 or 3 cases to show you about that. And we're going to go from simple. This is a patient that started Invisalign. She came to me actually in the middle or on the end of an uncontrolled lingual orthodontic. She had been with lingual braces. That was the day that I actually scanned her after I removed her lingual fixed appliances, because her orthodontist was back home, and she was in Boston, and she was seeing him maybe once a year. She came to see me for a couple of emergencies, to which I asked her if she wanted to transfer and switch and finish her with her appliances or with a new system back home, but she was still going back and forth to Asia with her orthodontist. So finally she decided, you know what, I don't know when I'm coming back home, so I need to get this over with. Actually, it's been over a year and a half at that point on inactive appliances. So I decided with her, we're going to remove everything. We're going to finish her with Invisalign. And because I wanted to be able to close that anterior bite and improve her occlusion and get this done as soon as possible, we started with vibration from the get-go. You can see here the open bite tendency, a little bit of irregularity. And after 7-day aligners, This is her final. You can see beautiful, settled occlusion, beautiful smile, only a few months of treatment, 19 aligners, no refinement, 7 days per aligner. This is the next one, getting a little bit more complex, a little bit more of an anterior open bite, canted arch, tongue habit, tongue thrusting. I have been talking with her as we're closing her bite she went to my functional therapist to help retrain that tongue. But the whole idea was to be able to close this with aligners around her arch and close and auto rotate that mandible a little bit. And again, like any other open bite case, no matter how simple or how complex it is, vibration is going to be my modality of choice. Is one of my non-negotiables. We go through ortho and vibration at the same time, because otherwise, in my mind, I don't want to get to refinement a year and a half later. I want to get to refinement if I need it a lot quicker and go through several months, close the bite, jump that bite, and detail and finish. So we started her with records in June. Again, we did 7-day aligners, and I have started to recommend actually since this year, 5-day aligners. That's what I'm doing myself. But you can see 21 aligners later, 21 weeks later, how the bite has started to close quite a bit. This is in October, 21 weeks after starting. And here you can appreciate the final with a nice settled occlusion, beautifully closed in April of 2018. Patient thrilled, still doing her exercises, trying to retrain her tongue to prevent that from happening again. But you can see that in 35 weeks of treatment, we went through a lot of aligners and a lot of bite closure. High frequency vibration from day one. And here's another one. This patient also had an anterior open bite, but also she had a very strong interposed lip. She had a lot of crowding on the lower arch. She had a little posterior crossbite and a broken occlusal plane. This was a little bit more complex. You can see how narrow her maxilla is, her palate is, although she had a very nice buccal plate, so I was comfortable expanding. We were playing with not only aligners and vibration, but at the same time, a lot of elastic wear just to improve the expansion and the crossbite. No extractions in this particular case. We were just dealing with aligners beginning to end. And this is hard. 29 aligners later, when I took refinement records, this is in August 2017, last year, you can see that not only the bite has been closing, the crossbite is improving, the maxillary arch is a lot wider, and the overjet is decreasing as well. The patient now is not interposing her lip closure is improving a great deal. This is our final. I would have loved to have a little bit better relationship on the left posterior segment, but I think that I can consider this obviously a success. You can see the profile, how the lips come together with no strain, absolutely relaxed. Her speech has improved a great deal. The overjet is reduced. Beautiful close bite and a nicer overall arch shape and form. So this was 20 aligners plus 18 refinements, total of 49 weeks, under a year, 7-day aligners with high frequency vibration. I don't think I would have been able to get this outcome with braces at all. The minute you put a bracket on these patients, you know that that open bite gets a lot worse from the very beginning, and then you have to resort, at least I have to resort to tags and more complex mechanics when aligners are so simple to deal with patients that are really happy and compliant with good home care, good health, no recession, no perio, no caries. I hope you're enjoying this presentation. I'm going to have some time for questions, but I wanted to share that I think that a quote from P.D. Barnum that I thought it was brilliant, and it says that the noblest art is that of making others happy. I love making my patients happy and giving them the smile they once had, or their smile that they always wanted to have, and now making that a reality. And being able to do that in a predictable and non-invasive way, I think it's even better. I don't think I have any questions. No, I don't have any questions here. I thank you so much for joining me, and I wish you a great night. I'm going to conclude this webinar. Have a great night, everybody, and I'll see you hopefully soon.